Okay, this is a continuation on Keith Spencer. This section, clinical diagnosis. 1. Alcohol abuse disorder, um, partial remission. 2. Major depressive disorder. 3. Generalized anxiety disorder. 4. He meets criteria for both of these conditions. His alcohol abuse has been the function of attempting to uh, an attempt to maladaptively cope with his overall dysphoria. Uh, the defendant also has a borderline condition, with his predominant symptomatology being his predominant vulnerability being one of identity related to identity confusion, identity problems, not confusion, identity problems, self-direction, and fears of interpersonal closeness likely related to his fragile sense of identity and sense of self and fear of abandonment and loss. Next paragraph, note that the defendant also has a struggles with hypersexual condition. His that in combination with his alcohol abuse had disrupted his life, and certainly and together together with his dysphoria and his impulsiveness and poor decision making has engendered his impulsiveness, poor decision making, and judgment, particularly notably when intoxicated. Next section, summary and conclusion. Mr. Spencer is a 37-year-old single male who is charged with 2 misdemeanor counts of indecent exposure and a felony count of possession of child pornography. At the time of the offenses, and currently he was living in La Habra. On his charges occurred in June and July of 2021. At the time and currently, he had been employed full time. Currently, he is on a number of medications for his anxiety and his depression and anxiety, including lithium, risperidol, gabapentin, and Ativan. At the time of the alleged offenses, his only psychotropic medication was Cymbalta for his depression, which had at the time been prescribed by his primary physician. Would you add this to a line or two, what I'm going to just dictate now, to the section on diagnosis? After I mentioned his depression, just put it anywhere, and I'll edit it. Note, beginning paragraph, the defendant has been recently diagnosed with as suffering from a mood disorder that was on the bipolar spectrum. I saw no evidence of any evidence of mania or hypomania during my assessment. I do agree, however, that he suffers from rather significant depression and mood instability, which due to a combination of factors, including his borderline personality traits, as well as his depression, and also his loneliness. All factors contributing to his emotional fragility and instability. Okay, now I'm going back to the to continue in summary and conclusions. Next paragraph. Mr. S. grew up was born and raised in Southern California in an intact family with with his parents and 2 sisters, one older, one younger. During his early developmental years, he was not particularly close to either parent, growing his mother as emotionally aloof, and father as someone who was a quote shell of a person, end quotes. As the years went on, and during his teenagers, he got closer to his father. He would have described his mother as narcissistic and self-centered. During his developmental years, he had a good relationship with his sibling. Since the incident offense, his relationship with one sibling is somewhat stressed. He was free of any conduct problems during his pre-adolescent or adolescent years. Always been a good student academically. He identified as academically gifted during his elementary school years. He became less interested in school and academics, however, in high school, possibly unlikely due to his emerging confusion over his sexuality and sexual identity. He went to, nonetheless, he obtained a high school diploma. He passed his high school proficient exam and attended junior college, but never graduated. Short of one class. Next, same paragraph. Mr. S has never been psychiatric. Next paragraph. Mr. S has never been psychiatric hospital and had been in treatment for. He had been in psychotherapy with a number of years during his 20s for his anxiety, depression, and self-esteem. As noted, he had been on Cymbalta prior to the incident offense. Subsequently, he's on a number of mood-stabilizing medications, and anxiety, and is currently receiving treatment for his alcohol abuse and psychotherapy, where his anxiety, depression, self-esteem, and sexual addiction issues. He also sees a psychiatrist and is in. Sees a psychiatrist medication. Next paragraph, the defendant has a long history of alcohol abuse. For years abusing vodka, and in more recent years, excessively drinking wine to the point of intoxication on a regular basis. As noted, he's been sober for about a year and a half, and attending the treatments noted above, as well as attending AA meetings and sexual and as sexual compulsive anonymous as well. He was free of any history of conflicts with the law or arrests or convictions prior to the incident offense. Next paragraph. At the time of the incident offense, the defendant noted, Mr. S noted that he had been drinking, quotes, every day, and quotes, 3 bottles of wine at night. At the time of his, of the accounts of exposure, he was intoxicated and has a vague memory of it. When he sobers up, he experienced intense shame and anger at himself. He also described himself as being disgusted over the child porn, over the illicit pornography on his website. And he noted that it was deleted as those images were downloaded. The pictures were downloaded, intoxicated. He indicated that he does not recall and does not believe he downloaded the videos on his phone. He had gone to websites where there are, quote, strange people, but admitted he had gone to websites where they, quote, strange people, end quotes, which the downloads may have been occurred, but when the downloads may have occurred. With respect to a risk for future offense, the defendant's a score of 1 on the static 99R, an assessment of his parentheses unchangeable culture and his risk of reoffense. That put him in the average risk range when compared to a sample of offenders. He was found to be to be at risk to reoffense at the low rate of 3.2% over 5 years. His only risk factor was his lack of any experience with interpersonal intimacy, that parentheses living with someone for at least a 2-year period of time. He has no history of prior convictions, criminal convictions or charges. He has no history of prior sexual convictions or sentencing dates. He's never been convicted for non-contact sexual offenses, no contact sexual offenses, or been charged with any in-person victimization. Also, his age was also a factor that lowered his risk for reoffense from a static point of view. On the stable 2007, he was scored within the high range of the moderate. Within a moderate range high range within high end of moderate range to reoffend. This is an instrument that measures his dynamic, that is changeable risk. The most salient features on this instrument that increased his risk to moderate level was his limitations in interpersonal. For instance, again, never have no history of intimate partner relationships, and his maladaptive coping style, that is using sexuality to cope with his aloneness, combined with his alcoholism, which increased his, which of course increased his which decimated his judgment and his impulse control. On the ions, which tests for both static and dynamic risk factors as well as factors, for instance, factors that lower is a risk for offense, placed him in the very low range for reoffense in both the dynamic and both the static and dynamic domains. This is because because the ions is assessment of overall risk for criminal offense, including sexual offense. He clearly is not someone who is prone towards criminality, again reinforcing the view that his misconduct, his sexual misconduct leading to the alleged offenses was related to his emotional difficulties and combined with his severe alcoholism at the time of those offenses. A closer look at the next paragraph. A closer look at the ions subscales revealed that his dynamic risk factors are also related to his interpersonal difficulties. He sees himself. He has a very poor self-esteem. Sees himself as unpopular. Period. As such, he self-emotionally from others. Next paragraph, the extensive testing certainly corroborated the defendant's emotional and interpersonal difficulties that were also by the ions. The testing clearly revealed his extensive alcohol difficulties and the extent of its negative consequences on his functioning socially and interpersonally. It also revealed the testing also documented his long-term struggle with anxiety and depression, and his interpersonal and his psychological problems with having and not having established a firm sense of self and self and identity. It also revealed his tendency to cope by isolating himself, leading to which this has apparently led to him feel alcohol again to assuage his loneliness. Of course, had rather destructive consequences on him and his social functioning. He was also tested to be hypersexual. This is this appears to be related to his isolation, and again a maladaptive way of coping with his loneliness and fears of closeness and abandonment. It's again a maladaptive way of meet his emotional and sexual needs that inevitably fails to gratify, which leads to increasing needs for more extra stimulation to avoid his the emotional dissatisfactions that he feels and is fearful of confronting and attempting to satisfy with legitimate intimate contact with another. Currently, the defendants, next paragraph, Mr. Spencer has been sober for over a year now, and in therapy. He seems more ready, he seems more aware Having been sober for this period of time, he seems more aware of his emotional difficulties and his need to solve them. As such, he's in he indicated that he is addressing some of these issues that we have identified, that I've identified in this report. In summary, in conclusion, then, Mr. S is an individual who has suffered from long-term depression, anxiety, and alcoholism. He also has fear of closeness related to his rather fragile self-esteem. Thinks of himself as an inadequate and unattractive person. That some of his appears to be what his outgoing behavior. On the his superficial outgoing behavior seems to be a way of coping with his more deeper feelings of inadequacy. Uh, in terms of his risk for reoffense, I would opine that he is in the he's currently the moderate risk to reoffense. If he in his sobriety, his sexual misconduct and impulsiveness and secondary appears to be secondary to his and manifest themselves during his alcohol abuse. When he's sober, he expressed, as I noted, quite shame about his own behavior, about his behavior. I would recommend, my recommendation is that he continue in psychotherapy, and that he continue in his psychotherapy, in his day treatment program, and that he and that he continue in his AA and SA. A reevaluation in 6 months, in 6 to 9 months, would also would also be a recommendation. Okay. The next paragraph. The above findings and opinions were given at the completion of my assessment of Mr. Spencer. Any additional discovery which I am given may alter my opinion. Period. If you have any questions, please feel free to call. Next paragraph. Thank you very much for allowing me to evaluate Mr. Spencer. Okay. And then this is my name and titles. Thanks.